Hi, my name's Michael. I'm a family nurse practitioner student with United States University. I'm going to be conducting a health history today. Do I have your permission to video record this?
Mm-hmm.
Okay, great. And your initials are DJ,
Mm-hmm.
and your date of birth is 12/18/1995.
Mm-hmm.
24 years old, or 25?
Well, I mean, 95 would be like 27.
27? Okay. And what's bringing you in today?
I just need a checkup, and
Okay.
then I have a little bit of a cough.
Okay, let's talk about your cough. When did that start?
Probably about 3 days ago.
About 3 days ago. Okay. And does the cough feel dry or wet?
Dry.
It's a dry cough. Okay. Any time of day that it's better or worse?
It's worse when I go outside.
It's worse when you go outside. Okay. Anything that you do make it better?
Cough drops.
Okay. Are you just taking over the counter cough drops?
Mhm.
Okay. All right. And how severe would you say this cough is?
It's not very.
Not severe.
No.
Okay. How bothersome is it for you? Is it interfering with activities or work or anything like that?
Not so much with work, but like outside of work
Okay.
activities.
All right. And primarily worse outside.
Mhm.
Okay. Does it keep you up at night or anything like
No.
that? Okay. Okay. Have you ever been told that you have allergies, allergic rhinitis,
Mm-mm.
asthma, anything like that?
I have asthma.
You have been told that you have asthma?
Mhm.
Okay. When were you diagnosed with asthma?
Childhood.
Childhood? Okay. And do you take anything for that?
I have Symbicort as
Okay.
needed.
So you use a rescue inhaler?
Mhm.
Have you used your rescue inhaler with this cough?
I think I tried it once and it didn't really help.
It didn't help. Okay. Any other past medical history?
Just migraines,
Okay.
occasional episodes of low blood pressure,
Do you take anything for the migraines?
just Tylenol.
Okay, just
And
over
I
the
have
counter?
to sleep it off.
Okay. And you said every once in a while you have low blood pressure? Okay. And is that postural? Does it happen when you stand up or?
Usually when I stand up too fast.
Okay. Have you been worked up for that at all?
I mean, in middle school, but not really since.
Hasn't happened since? Okay. All right. Have you ever had any surgeries before?
I've had my tonsils taken out.
Okay. What age were you at that?
It's probably 8.
Okay. And I imagine you probably stayed the night in the hospital for that.
I think so.
Okay. Any other hospitalizations?
Mm-mm.
Okay. All right. Okay, so aside from the cough drops, the occasional Tylenol, the Symbicort,
Mhm.
are any other meds that you're taking?
Mm-mm.
Okay. You don't take any birth control, anything like that?
Mm-mm.
Okay. All right. Are you allergic to any medications?
Not that I know of.
Okay. What about latex?
No.
Shellfish or iodine?
Mm-mm.
And do you have any environmental allergens such as dust, mold?
I think more so like dander
Okay.
than anything.
Okay. All right. When was your last period?
It's been about a week.
Okay. How would you characterize your periods? Would you characterize them as heavy, light, regular?
I feel like they're on the lighter side.
Okay. And do they come on a regular basis?
Mhm.
Okay. Okay. And have you ever been pregnant before?
No.
Okay. All right. We're going to move on to your family, okay? So when I say family, I'm talking about mom, dad, grandmas, grandpas, okay? Brothers, sisters, okay? Any significant family history with your mom?
She has really heavy periods. She's anemic.
Okay.
And she just had cataract surgery, but I think that's about it.
Okay, and how about your mom's mom, your maternal grandmother?
She had diabetes, hypertension, high cholesterol.
Is she still living?
No, she passed of a heart attack.
At what age?
She was in her mid-50s. She was pretty young.
Okay, and how about the maternal grandfather?
I think he also had hypertension and high cholesterol.
Okay.
I don't know much else about him.
Okay, is he still living?
No, he passed in his 70s.
Okay. And do you know what from?
I don't.
Okay. And how about your dad?
He's pretty healthy.
Okay. And his parents?
As far as I know, they're also pretty healthy.
Okay. All right. Okay. We talked a little bit about your period. I asked you about birth control already. Are you sexually active?
Not right now.
Okay. Okay. Do you use any tobacco products?
No.
Cigarettes, cigars, pipes, chewing tobacco?
Can't stand it.
What about vaping?
Nope.
Okay. So never tried it, nothing.
I tried to vape once, and I was deathly sick after.
Okay. Okay. And how about alcohol use?
I drink occasionally.
Okay.
Maybe once or twice a month.
Okay, and when you drink, how much do you drink?
If I'm out with friends, it's a couple drinks. If I'm by myself, it's usually just one.
Okay. When you say a couple, you mean 2 to 3, 3 to 4, more
It
than
depends
that?
on the night.
Okay. Do you ever feel that you need to cut back on your drinking, or do you feel guilty about drinking?
No. I have a pretty good handle on it.
Okay. How about street drugs?
No.
No,
I've
never
never touched
experimented, nothing? Okay.
Mm-mm.
All right. And have you ever been married?
No.
Okay, so currently single?
Mhm.
Okay, and what do you do for a living?
I'm a teacher.
Okay. What do you teach? What grade?
Kindergarten.
Okay. I imagine that could probably be challenging at times, huh?
Yeah.
Okay. All right. And do you exercise regularly?
Not as much as I would like.
Okay. Do you exercise at all?
I mean, I do a lot of running around at school.
Right.
And then I try to get in some walks with my dog whenever he goes out. But aside from that, not too much.
Okay. What type of diet do you follow?
I don't really have any restrictions.
Okay, so you don't do like vegetarian or
Mm-mm.
anything like that? Okay.
Mm-mm.
Do you eat a lot of fast food? Or would you say that you eat pretty well balanced diet?
I think it's pretty well balanced.
Okay. Are you familiar with the My Plate from the USDA? The recommendations? Okay. All right. And how much sleep do you get on an average night?
Between 5 and 7 hours.
5 to 7 hours, okay. And do you feel that's adequate for you? Do you feel that you're tired?
I think it's pretty good for where I'm at right now.
All right. And how would you say your stress level is?
It's better than it's been.
It's better than it's been?
Mhm.
Okay, and how long has it been better?
Probably 3 or 4 weeks.
Okay. What are some major stressors in your life?
Well, my mom had surgery a few months ago,
Mm-hmm.
so that was big.
Okay, sure.
I just moved, school.
Yeah, certainly all those things can definitely increase your stress levels. Okay. Are your immunizations current?
I think all of them are.
It is flu season. Have you had the seasonal flu shot?
I have.
Okay. Have you had the COVID vaccination?
Mm-hmm.
Okay. All right, good. And do you recall when your last tetanus shot was?
I have no idea.
Okay. So typically we recommend tetanus shot every 10 years unless you have a tetanus type of injury, which would then reduce it to 5 years, okay? So, you know, stepping on a rusty nail, that type of stuff, that would be a tetanus type injury, okay? All right, so we're just gonna kind of go over everything head to toe. These are simple yes or no questions, okay? Just starting out with general feeling, any fevers, chills, or night sweats?
Mm-mm.
Okay. Any loss of appetite or unexplained weight loss?
Mm-mm.
Okay, great. Any blurred vision?
Not any more than normal.
Okay. Any abnormal discharge or redness of your eyes
No.
or anything like that? Okay. Any hearing loss, ringing in your ears, dizziness? Okay. Earaches?
Every so often, but not really.
Okay. You told me about the cough earlier. Do you have any runny nose associated with that?
Occasionally.
Okay. And you feel stuffy at all? Are you
No.
able to breathe out of both sides of your nose? Okay, good. Any nosebleeds?
No.
Okay. Any pain or difficulty swallowing?
Mm-mm.
Okay. When was your last dental exam?
It's been about a year.
Okay. All right. All right, we're gonna move on to your heart. You ever feel any palpitations or like your heart's fluttering in your chest?
Occasionally.
Occasionally. Okay. What usually brings those on?
I have no idea.
Okay.
It's just out of the blue.
You don't notice that any excessive caffeine intake or anything like
Mm-mm.
that? Okay. Have you ever been seen for that or worked up for that?
I was when I was younger,
Okay.
but they never really found anything.
And does this go back to with your low blood pressure?
Yeah.
Okay. All right. Any shortness of breath, difficulty breathing?
Mm-mm.
Okay. All right. And any swelling of the hands or feet?
Mm-mm.
Okay. All right. How about any nausea, vomiting, diarrhea?
No.
Okay. And you said no changes in your appetite?
No.
Okay. Any rectal bleeding or blood in the stool?
Mm-mm.
Okay. And any burning with urination or increased urination,
Mm-mm.
decreased urination,
Mm-mm.
flank pain, anything like that?
Only whenever I get really stressed. I
Okay.
get flank pain
Flank pain.
sometimes.
Okay. And we'd already talked about your period patterns, any vaginal discharge or dryness.
Not anything out of the normal.
Okay. All right. And moving on to the musculoskeletal system, any joint pain or stiffness,
Mm-mm.
back pain.
Mm-mm.
Okay. All right. How often do you do a self breast exam?
I try to do one every month or two.
Okay. And have you noticed any bumps or lumps?
No.
Okay. Any discharge from the nipples?
No.
Okay. All right. Any headaches, dizziness?
I mean the occasional migraine.
Okay, your occasional migraine. Okay. And anything like memory loss or
No.
numbness or tingling anywhere? Okay. How about anxiety, depression?
Occasionally.
Okay. Is this back to kind of the increased stress levels with job and stuff like that? Okay. All right. Any suicidal thoughts? If you ever feel like hurting yourself?
No.
You ever feel like hurting anybody else?
Don't we all?
Right. Okay. All right. And you said you haven't had any unexplained weight loss or weight gain,
No.
nothing like that. Any increase in thirst or increase of urination?
No.
Okay. And any excessive bleeding? You said you had a family history. Your grandmother had anemia.
No.
Okay. And any easy bruising?
Yes, I bruise like a peach.
Okay. And any tender or swollen lymph nodes anywhere?
Not right now.
Okay. And we talked about your allergies and everything like that. Just pet dander was the primary culprit. Okay. Well, that concludes this portion. Okay. I appreciate your time. And thank you.
Mhm.